Ambulance service for Sussex and Surrey is suggesting that people meet outdoors this Easter to reduce the risk of COVID and pressure on 999 calls. The latest official coronavirus survey has found infection levels beginning to fall in the southeast, but still about 1 in 15 people would have tested positive last week. Today we've heard how more than 1 in 50 hospital patients in the southeast have been waiting for at least 12 hours to be admitted to A&E. Doctors here are warning that they're having to deliver care at the moment in hospital corridors and say it's deeply uncomfortable and unsafe. James Blythe, he runs Epsom and St Helier hospitals.
Well, Sean, we have been very busy, and as we approach the Easter weekend, we expect that to continue. So we are here to support people who have an emergency and need to come to A&E and are in need of our help for emergency medical treatment, but we would also ask people to consider if they have less urgent needs for care, whether there are other alternatives, whether there are other places that could potentially meet their needs over this weekend.
James, in your opinion, what's causing the issues that you have right now?
There's not one particular thing that's causing some of these challenges across the system. We as a society are continuing to live with COVID. And we continue to treat a number of people in our hospital, both who are unwell with COVID, but also people who are admitted for other reasons. And then when we test everyone who's admitted to the hospital, and then some people we find do actually have COVID, even though they're not symptomatic. So we work really hard within the hospital to make sure that these patients are appropriately supported. We know that after we have had a wave of COVID, we do see more attendances and more admissions for a period of time. And we also know that, for example, we've got quite a high number of presentations of people with mental health conditions at the moment. And we're working really closely with our partners in mental health services to make sure that if people do come to A&E, that we're able to get them the right support for those sorts of services. So I wouldn't say there's one thing, Sean. I think the fact is that the NHS is very busy at the moment, and there's a number of things contributing to that. We will always make sure that people who are in need of emergency medical care get the support that they need. So, if you are told to call an ambulance by, for example, 111 or by another healthcare professional, you absolutely should. If you are told to go to A&E or you have a medical emergency, that is absolutely the right thing to do. But what we would signpost people towards is that there are other options for support. There are GP services that are running over the weekend. You can call 111, and there are other forms of support, such as pharmacy as well. So please do look at your GP website. Please do look at the NHS website, and please do contact 111 if you have a less urgent need, because this will mean that we're really able to prioritise care for those people with the most serious emergencies.
The ambulance service and the body which runs the NHS in Surrey have both put out warnings about it being particularly busy over the forthcoming Easter weekend. Is that what you're expecting as well?
Yeah, I mean, we are expecting that as we've been very busy for the last few weeks and months, that will continue over the weekend. So that's why, along with the ambulance service and along with local NHS leaders, we are putting out communications about other options for people to access care, so that people are fully informed and can make the right choices.
CCAM suggests people meet outdoors rather than indoors this Easter, as COVID cases appear to be high. Do you agree with that advice?
Well, what I should say is I think that people should follow the advice that is available to them. I think that people should follow national advice, and I think that people should also make their own judgments and risks. So, I mean, I think that it's really important that people take responsibility for making those judgments for themselves.
So that's the view from an NHS Trust boss. What I'd really like to do now is speak to someone who's very much on the front line. Dr. Salwa Malik is an emergency consultant at Brighton Sussex University Hospitals, and is speaking to us as regional chair of the Royal College of Emergency Medicine. Dr. Malik, thanks very much for being with us this evening.
Thank you, Sean.
Well, the monthly figures out today, are things getting worse when we look at these or better in the southeast?
They're getting worse. They're getting much worse. The southeast has the highest month-on-month increase in just the 12-hour waits in whole of England. Compared to February, literally, a month or two ago, we've got an 18.5% increase in the number of attendances to major A&E departments. There's been a 130% increase in the number of patients that are waiting 12 hours or more for admission compared to February. Only February, not February last year, February this year. It's unacceptable. It's appalling and it's unacceptable.
And the amount of time they're waiting, this is ending up, as we mentioned a short while ago, with you treating them in corridors. I mean, what's that like?
Well, I know a lot of my colleagues hate doing this across the region, and it's a very uncomfortable situation to be in. No one wants to be in that situation, but unfortunately for a lot of my colleagues, they have no choice. We have to do what is right for our patients, and we have to keep our patients safe in the best way possible. The caveat is that if we do not take them into the corridors, we end up having these patients waiting in the backs of ambulances, literally outside the door of A&E. And therefore, these ambulances can't be turned around and get back into the community ready to pick up, quite unwell patients who are waiting for them. So it just caused a whole sort of, dominoes effect, really, on the whole system.
Unless we're doing the job that you and your colleagues are doing, we can't possibly know, me talking to you now, anybody listening to this, what sort of pressures are on doctors and nurses in Sussex and Surrey. Can you give us an idea of how that is at the moment?
All I can say is everything feels very serious right now. We're in unthinkable situations. I mean, we're in April. We were, the heaviness, the stressful situations, the overcrowding, that was, we were told, supposed to be a winter thing. We know for a fact that this is a thing that happens all year round. What we didn't know was that it would actually get worse as the year went on. We thought it would just stay a bit static. The problems that we're having is that not only is there a significant deficit in nurses and doctors and radiographers and physiotherapists, etc. already, and that's pre-COVID, that is just a general fact. Not only do we have that, but we also are combating high levels of COVID-related sickness in staff as well. And that means that we're running on bare minimum, sometimes less than bare minimum, suboptimal staffing levels to run departments, which is unsafe. And it's scary. It's very scary. We've got a massive responsibility in our shoulders. Constantly, my colleagues and the nursing staff, the HCAs, occupational therapists and physios that we work in our department feel very responsible for keeping these patients as safe as possible without any untoward events happening. But we're being put in impossible situations, and unfortunately, it just looks like we don't have a choice.
We know that the CCAM ambulance service is suggesting people meet outside this Easter. Are you asking people to follow similar advice as far as you're concerned?
Well, I'll tell you what, Sean, I'm actually on this weekend doing night shift, so I would really like a nice bit of night shift this weekend.
You deserve it.
So I will implore. I would absolutely echo what CCAM have said. It's very sensible advice it's lovely weather. This is great. So yeah, have the garden party by all means, have everything outside, do socialise. It is important for our mental health and our well-being as well. But be safe and be sensible. And of course, if you have symptoms, you really must get tested because it is for the protection of yourself and for others. And as you just mentioned, we have seen an increase in the southeast. The numbers may appear to be coming down, but we're still battling it in the hospital at the moment. It doesn't feel like it's getting any easier for us. So, of course, we would want to warn the public that it is very much still present and that we would still exert caution when they are socialising with people. But also I'd like to echo what my colleague from Epsom's and Helios just said with regards to using any other facilities that you can. So, of course, emergency departments will always be there for the public 24/7. But actually, if it is just a minor injury, then minor injury units are perfectly capable of seeing you. Certainly, pharmacists can be there to help and assist. And, of course, if you call 111, you will get put through to the out-of-hours GP service, and the GPs are working all weekend in that service. So there are other options for people out there over this bank holiday weekend, but this will be a difficult weekend because it's a 4-day weekend. So it's going to be particularly tough because we won't be able to get patients out into the community in time. So it's going to be causing a massive backlog and therefore a massive problem in the emergency department.
Dr. Salwa Malik is emergency consultant at Brighton and Sussex University Hospital, speaking to us as regional chair of the Royal College of Emergency Medicine this evening. Thanks very much for your time, Dr. Malik, and hoping that you and your colleagues get some downtime over the Easter weekend as well.